While Ethiopia is at the forefront of a military trend in Africa that sees armed drones becoming an increasingly sought-after military option across the continent, Rwanda has taken a totally opposite approach to drone technology. The use of drones is one of the latest strategies in Rwanda's push to modernize its agricultural, health, and infrastructure sectors. In the last 6 years, drones have transformed blood delivery in the small East African country. When you visit Rwanda, you might get to see these autonomous aircraft shuttling between rural and mountainous areas of the country. According to a new analysis, they have proved to be faster than driving. How did Rwanda get here? Let's find out. Rwanda had a blood delivery problem 6 years ago. More than 12 million people live in the small East African country, and they, like people in other countries, are occasionally involved in car accidents. New mothers experience hemorrhage. Children who are anemic require blood transfusions right away. These emergencies are unforeseeable. They simply occur. When they do, blood stored in one location must find its way to a patient in another in the shortest time possible. If you live in a city, this isn't a major issue. In the United States and the United Kingdom, urban areas with high-traffic hospitals and blood banks house 80% of the population. In African countries like Libya, Djibouti, and Gabon, cities house 80 to 90% of the population. However, in Rwanda, the figures are reversed. 83% of Rwandans live in rural areas. When remote hospitals required blood, it was traditionally delivered by road. That's not ideal. The country is mountainous. Roads can be hot, long, and bumpy. Donated blood can be kept cool for about a month, but some components that hospitals isolate for transfusions, such as platelets, spoil in days. A bumpy ride isn't ideal for such finicky cargo. Rwanda's government signed a contract with Zipline, a San Francisco-based drone startup, in 2016 to improve blood delivery. Zipline's self-driving drones would transport blood from a distribution hub to the healthcare facility. The blood in an 4 bag would parachute down into an insulated cardboard box, and the drone would zip back up. Zipline currently operates 2 hubs in Rwanda, each of which can handle up to 500 deliveries per day. And now, for the first time, there is evidence that drone blood services improve delivery speed while decreasing waste. Half of the nearly 13,000 analyzed drone orders between 2017 and 2019 took 41 minutes or less to deliver by drone. That median time on the road would be at least 2 hours. The number of reports of squandered blood donations has decreased. According to data, drones outperform cars. Delivery times vary depending on distance, but drones consistently outperform traditional driving times. The drones also help to reduce the amount of blood that expired and went to waste. These savings grew over time. After a year, drones reduced wasted blood by 67%, resulting in 140 fewer expirations from 2017 to 2019. The research is the first to look into medical delivery drones in Africa. Drone programs are more common in higher-income countries, where they deliver medicine and defibrillators. It's incredible to see that delivery drones are actually feasible in African environments. Drones appear to fill a significant need. They are especially beneficial for emergency blood transfusions. Malaria, which can cause severe anemia, poses a threat to children in East Africa. The delivery drone is unquestionably a game changer for remote areas. Platelets, fresh frozen plasma, and cryoprecipitates, special proteins isolated from plasma, can now be ordered in rural facilities. If these were not available locally, patients would have been referred to another hospital and transported by ambulance. It's worth noting that this isn't the only health tech innovation implemented by Rwanda's Ministry of Health. Despite its rural demographics, Rwanda has a reputation for being a leader in health tech innovation. Rwanda's universal healthcare system covers more than 90% of the population. The government piloted Rapid SMS, a phone-based program, in 2009 to track and reduce maternal and child mortality. By 2013, Rapid SMS had linked 15,000 villages to the larger network of doctors, hospitals, and ambulances in the country. They have one of the most comprehensive electronic data systems, allowing the Rwandan Ministry of Health to track how many people visit doctors, how many have malaria or HIV, and how many give birth in healthcare facilities. All great endeavors present their own set of difficulties. One of them is the delivery fee. The cost of these deliveries is unknown. The cost has not been disclosed by Zipline or the Rwandan government. Zipline claims to offer a faster, more sustainable delivery method that is also less expensive than traditional delivery and courier services. There have been calls for greater transparency regarding Rwanda's contract with Zipline. Other challenges are technical in nature. The biggest current limitation for drones is battery size. Payload and range are limited until batteries become less expensive and more powerful. Furthermore, drone deliveries are inherently one-way operations. They can drop blood by parachute but not pick up samples. These are some of the areas where research is currently being conducted. Zipline has partnered with the government of Ghana, in West Africa, to deliver blood, medicine, and vaccines by drone in the years since it began blood distribution in Rwanda. As drone companies seek to expand into new markets, they must also address the political concerns of some state officials, who are concerned that drones could be used to drop bombs. Any airframe large enough to transport something valuable to communities is also large enough to transport something that could harm those communities. Thanks for watching. If you like this type of content, make sure you subscribe and turn on the notification bell for more stories.